Hi. This is Dr. Advait Kulkarni with us today. He's a senior neuro consultant, and this is Dr. Garima Chaudhary. I'm a homeopathic physician and a counselor. Welcome to today's episode where we are diving deep into a silent and dangerous threat to our brain health, brain hypoxia. So, it's something most people don't even think about. Yet, it plays a role in strokes, migraines, dementia, and long term cognitive decline. So, we often associate brain damage with head injury or stroke. But what if I told you that our daily habits like poor sleep, chronic stress, even just living in a polluted cities could slowly deprive your brain health oxygen? Yes, today we'll break it down from causes to cutting edges treatment. And most importantly, how can you protect your brain? And let's get started with doctor.
Thank
So,
you very much, Garima, for this wonderful introduction. And it is a topic which is very important because it affects all the age groups. We
yes,
see brain hypoxia in children, in the newborns, which can have devastating effects on the development of the child. We see brain hypoxia in elderly people, especially people who are having heart attacks or prolonged strokes or head injuries.
yes.
So I think we should start.
Okay, so I'll go with the first question. So, what exactly is brain hypoxia and how does it differ from other types of oxygen
So
deprivation?
basically, brain hypoxia is reduced oxygen supply to the brain, and it happens when the brain does not get enough oxygen. And it differs from the word hypoxemia, where the oxygen in the blood is low. But when the oxygen in the brain is low, we call it as hypoxia. These are just the technical terms. But what happens when the oxygen level to the brain is reduced? See, within 4 to 6 minutes, the brain cells start dying.
Yes.
And the bad news is brain cells cannot regenerate themselves. Unlike you get a fracture or you get a cut on your skin, the skin can regenerate, the bones can heal in months. But brain cells unfortunately cannot regenerate. Whenever there's a brain damage, whether it's because of stroke or head injury or hypoxia, the surrounding part of the brain has to take over that function. This is called neuroplasticity. And understanding that brain cannot regenerate, the brain hypoxia is something very, very dangerous. So the studies have shown that brain hypoxia is an important factor, even development of dementia and cognitive decline.
So, I'll go with the second question. Can you explain the different levels of hypoxia from mild to severe and their impact on the brain?
See, these patients with brain hypoxia can come with varied symptoms. Like you must be remembering during COVID, many people did not get ventilators. Why do they need ventilators? Because the infection in the lung is so severe that some of them developed confusion. Some of them, in case of mild hypoxia, they develop brain fog, headaches, dizziness, and because of that they had a reduced oxygen level in the brain, and some of them developed moderate symptoms like confusion, even vision disturbances, even short term memory loss, and this can actually cause the damage to the brain. And unfortunately, severe hypoxia can lead to unconsciousness, it can lead to coma, can lead to seizures, and long term effects can include permanent cognitive damage, permanent damage to the cognitive abilities, as well as death. So it's very important to treat hypoxia in time. And it is well known that mild to moderate hypoxia, when it happens in repeated episodes, can lead to Alzheimer's dementia, which is the most common cause of dementia.
Okay.
Yes.
So, what else are the most common cause of hypoxia other than this?
Yes, as we have seen during COVID, it was very scary for all the doctors and all the communities. And but most common cause for brain hypoxia is cardiac arrest. We see that elderly patients or even nowadays young patients, because of bad lifestyle, they develop sudden blockages in the heart. The heart doesn't function properly, because of which the brain doesn't get the blood supply, and it can lead to cardiac arrest. Patients with stroke, where there is blockage in one of the arteries which supplies the brain, or there's a bleeding in the brain, especially the vital areas of the brain, like a small brain which controls respiration, that can suddenly reduce the respiratory drive and reduce oxygen supply to the brain. Patients with severe low hemoglobin, you must have seen women, Indian women are known for low hemoglobin or
Yes.
anemia. Severe anemia can lead to reduced blood supply, reduced oxygen supply to the brain. And of course, the second common causes would include respiratory causes like lung infections, COPD, asthma, people who have acute asthma attacks and sudden wheezing, which can lead to sudden reduced blood supply and can lead to confusion and all the symptoms. One very important cause is sleep apnea. See, this sleep apnea is often neglected, and young patients or patients who are obese or who are having upper airway obstruction, they can develop episodes of apnea, that is reduced breathing, reduced blood supply to the brain in sleep because of excessive snoring. And this sleep apnea is known to cause brain damage over a long term period. It is one of the common causes of hypertension, heart attacks, and also brain hypoxia, which can lead to dementia and memory problems. Of course, accidents like choking, drowning, carbon monoxide poisoning can cause, and rare causes include migraines. Patients with chronic migraines, if they are untreated, they have found to have long-term neuronal damage because of hypoxia. Patients with epilepsy and traumatic brain injury also can lead to hypoxia.
Okay. So, doctor, I want to ask that are there any specific group of people who are more at risk of brain hypoxia, and how does their lifestyle and environmental factor contributes?
Of course, there are certain high risk people, as we have seen people who are elderly, that is beyond 65-year-old, or even nowadays youngsters, because of bad habits like smoking, alcohol, and sedentary lifestyle. These are more prone to develop strokes and neurovascular disorders, and also heart attacks, which leads to hypoxia. Sleep apnea patients, as we discussed, which leads to chronic nocturnal hypoxia, especially in the night. They don't get oxygen supply, and they have something called micro arousals. So typically a wife complains, I cannot sleep with my husband because he's snoring a lot. And because of that, does he have sleep apnea? Yes. Patients who snore excessively in the night, and especially if they feel daytime sleepiness, if they feel sleepy during the day, they should be evaluated for sleep apnea, because it is one of the causes of hypoxia. Cardiac patients are at a higher risk due to poor circulation. People who are athletes and high altitude climbers and divers, they are exposed to low oxygen environments. So all these factors are very important to consider when we look at the high risk groups. And what about the lifestyle and environmental factors, as you said? See, people who are in chronic stress, they often do hyperventilation. They reduced, because of that, there is reduced CO2, and there is vasoconstriction. There is a vasoconstriction, means the blood vessels will become small, and that may lead to hypoxia. You have heard that in Delhi the pollution is so high that there is a reduced oxygen levels in the urban areas. Sedentary lifestyle, poor oxygen delivery due to weak circulation is also one of the important factors. There was a study in 2024, a very interesting study by UCLA, which have shown that pollution driven hypoxia increases the stroke risk by as high as 30%. And we are seeing patients who often travel to hilly places, like near Kashmir and Ladakh areas,
Yes.
where suddenly they go to the higher altitudes, and because of hypoxia they develop seizures. And the problem is there are no hospitals there.
Yeah.
And there is a panic situation. So whenever you are traveling to a high altitude area like Ladakh, you have to get yourself checked, and you have to consult your physician before planning a travel there, so that you can avoid all these untoward accidents.
Yes, great. So, can you tell us that what are the early signs and symptoms of brain hypoxia?
As we discussed, there are varied signs from headache, dizziness, memory problems, confusion, even difficulty in concentration. Patients just come with short-term memory loss, which is sudden in onset, and dizziness, blurred vision. Sometimes when the hypoxia is moderate to severe, patients may have difficulty in speaking, slurring of speech. They have difficulty in understanding speech. Some of them may have difficulty in coordination. They are not able to walk properly. They wobble, and there is coordination is impaired, especially the hand coordination, the leg coordination. And it is very interesting to know that a study from Mayo Clinic in 2023 showed that brain hypoxia in elderly can be misdiagnosed as early dementia.
Okay.
Suppose a patient is having a chronic respiratory disease like a COPD or a asthma or any other lung disease like interstitial lung disease, because of which the brain oxygen levels are low repeatedly. There is a brain hypoxia. But sometimes when they come to a physician, a neurophysician like us, we may confuse it with early signs of dementia because the symptoms are similar. But it's very important to measure the blood oxygen levels in these patients and do a systemic examination as well.
So here comes the question that how the brain hypoxia is then diagnosed and what tests are typically performed to diagnose it.
So it is very important to diagnose brain hypoxia. First of all, suspect, and most of these patients land up in emergency department. So first thing what we check is their airway, breathing and circulation, whether they are able to breathe properly, how is the airway patent, how is the circulation. We check their BP, pulse rate. We also check their blood oxygen levels through a test called arterial blood gas, where we remove the blood from the arteries and check the various parameters like bicarbonates and oxygen levels and CO2 levels. Then in certain cases where the diagnosis is confirmed, to see the severity of damage, we do a MRI scan of the brain to look for any ischemia or permanent damage. EEG, that is the electroencephalogram, detects the hypoxia-induced brainwave abnormalities, and it helps us to stratify the severity of hypoxia. Like for example, there is something called burst suppression pattern, where it is supposed to be indicative of severe brain damage. So EEG and other cognitive tests, like a patients with mild to moderate hypoxia who are still conscious, we need to do a cognitive test to assess the impact on memory and attention. It is very important to do all these tests in brain hypoxia patients to understand the severity of the disease. And a study from Harvard Medical School in 2023 has shown that AI assisted EEG helps to improve hypoxia diagnosis by about 40%.
Okay.
Yeah.
So that could be a difficulty. So how the doctors are able to differentiate between hypoxia and other neurological conditions?
Of course, because the symptoms can be overlapping. Many of neurological conditions come with symptom of confusion, difficulty in speaking. We do see daily patients with headache and dizziness. So how to differentiate? Of course, we need to do a brain imaging, because even brain tumors can also present with these symptoms. Any clotting in the brain, any bleeding in the brain. So we need to rule out the stroke. Often I remember a patient who came to me in the age of more than 80 years old, and he had a very mild confusion, difficulty in remembering, and very subtle symptoms. But only thing is he had a slight weakness of one side of the body. That is why I ordered a MRI scan in him, and to my surprise he had a large tumor on the left side of his brain. So initially what it looked like dementia, but later on careful examination and after doing an MRI, it was actually a tumor and not a dementia or a hypoxia. Next is patients with epilepsy can have signs of hypoxia. You must have seen mirgi jise bolte hai, epilepsy, where a patient has rigorous movements of the body, uprolling of eyes, and patient becomes unconscious. That also can lead to hypoxia. And it can be confused with hypoxia. So EEG helps to differentiate between hypoxia and epilepsy. And blood gas analysis helps us to understand and confirm the diagnosis of hypoxia over dementia. Because in dementia, the blood gas will be normal, whereas in hypoxia, the blood gas will show various abnormalities like low oxygen levels.
So, what are the primary treatment options for the brain hypoxia and how effective are they?
So, most important thing, as the patient comes in the emergency department, so whenever you experience your loved one is having sudden unconsciousness or sudden confusion, it can be a stroke or it can be hypoxia because of any other reason. Best way is to go to a stroke equipped hospital, nearby hospital, and immediately the doctors assess the airway, breathing and circulation. Check what is the problem. It can be some choking also in children. It can be some infection in the lungs. It can be something related to brain or it can be a long-term chronic issue like sleep apnea. So one is we treat it with inhaled oxygen or a mechanical ventilation. Patients who have severe difficulty in breathing, we use ventilatory support. Hyperbaric oxygen therapy, which enhances oxygen delivery, is one of the very important treatments and helps in post-recovery by 60%. Medications like neuroprotective agents like magnesium, sulfate and anti-inflammatory agents are very, very important. So it is very important to reach emergency department as soon as you experience these symptoms.
Okay. So how quickly a doctor need to act to minimize the brain damage of the hypoxia patient?
As is very interesting that brain cells start dying within 4 to 6 minutes of reduced blood supply to the brain.
Yes.
So whenever the oxygen is low, within 4 to 6 minutes, we have to act. So faster intervention means better recovery. If you delay it, it can cause permanent brain damage and permanent effects on the brain. That's why we say time is brain. And if you have any symptom like confusion, altered behavior, altered sensorium, or loss of consciousness, especially patients who are elderly and patients with heart conditions, you have to immediately consult the doctor, because sometimes time is brain and the time is limited.
Yes.
Especially as far as brain is concerned, it's very, very important.
So can brain hypoxia be reversed, or if caught early, are the effects are permanent, like permanent damage of the brain? As you said, yeah, it is, but still I want to know.
Absolutely. So if we are able to treat the brain hypoxia within minutes to hours, we can see that it causes a reversible damage. So I remember I had a patient whom I was telling,
Yes.
a young individual who went to Ladakh. Because of the altitude, he had hypoxia and he had a seizure which lasted for almost 10 minutes. And by the time he recovered, it took hours to recover because of seizure. But when I saw him after 3 to 4 days of the incident, when he came back to Bangalore, he luckily had no deficits. Because in his case, immediately he got oxygen supply and immediate medical attention is very, very important. However, there is another patient who was around 70-year-old and he developed a heart attack at home, and unfortunately there was nobody around. He fell down in the bathroom, and then when he was brought to the hospital, he was in severe hypoxia. The blood levels of oxygen were very low, and when we did an MRI, there were multiple areas of damage in the brain. So in such patients, it's very, very critical. They need ventilatory support. They get various symptoms like myoclonic jerks, coma. And in this patient, unfortunately, he had a permanent damage and he never recovered fully. Although we were able to save his life, but he had a permanent damage and severe dementia and cognitive deficits along with executive dysfunction.
Okay.
Yes.
Okay. Is there a possibility for fully recovery? As you said that this patient got recovered but not as fully, but still, is any possibility?
Absolutely. So as I said, there is a chance that people do recover fully if they get treatment within minutes to hours. Suppose take a child with choking.
Okay.
A child is playing with some nuts or trying to eat groundnut and it gets choked in the unfortunately in his windpipe. If we detect it and immediately we do something called Helmich maneuver,
Yes.
we hold from his tummy and or consult a doctor and immediately you remove that, then the hypoxia will not have permanent effects.
Okay.
So the treatment is very, very rewarding because the brain cannot regenerate itself. As the other tissues like muscles and skin, brain is unable to regenerate.
Okay. Thank you so much, doctor, for a lot of information about brain hypoxia.
Yeah.
So we want to learn from you more and more in the future. Thank you for
Yeah.
this podcast. Thank you
Yes.
so much.